High blood pressure is called the silent killer for a reason. Most people with dangerously high blood pressure feel completely normal. No pain, no obvious symptoms, right up until the moment it causes a heart attack or a stroke. But here's what medical researchers have discovered in recent years. Your body does send signals. Subtle ones that are easy to dismiss as just getting older or just being tired. In this video, I'm going to walk you through 7 warning signs that your blood pressure may be dangerously elevated, including sign number 4, which is one that most people never connect to blood pressure at all. If you recognize yourself in even 2 or 3 of these signs, please make an appointment with your doctor this week. Not next month, this week. By the end of this video, you'll know exactly what warning signs to watch for, what blood pressure numbers actually mean, and 3 simple lifestyle changes that clinical studies show can lower blood pressure significantly, sometimes within just a few weeks. As always, please speak with your doctor about your personal situation. What I'm sharing is based on research from the American Heart Association and the National Institutes of Health, but your doctor knows your full health picture. Now, let's start with some numbers that matter. According to the American Heart Association, nearly 70% of adults over the age of 65 have high blood pressure, also called hypertension. And of those, approximately 1 in 5 don't know they have it. Blood pressure is measured with 2 numbers. The top number, systolic pressure, measures the force when your heart beats. The bottom number, diastolic, measures the pressure when your heart rests between beats. Normal blood pressure is below 120/80. Stage 1 hypertension begins at 130/80. Stage 2, which carries significantly higher risk, begins at 140/90. A blood pressure of 160/100 more than doubles your risk of stroke compared to someone with normal blood pressure. And over time, sustained high blood pressure damages the walls of your arteries, your kidneys, your eyes, and your heart, often invisibly. This is why knowing the warning signs matters so much. Warning sign number 1, morning headaches. Headaches that appear when you wake up, particularly at the back of the head, are one of the more recognized signs of elevated blood pressure. Blood pressure naturally rises in the early morning hours as your body prepares to wake up. For people with hypertension, this morning surge can push pressure to dangerous levels. If you regularly wake up with a headache that fades within an hour or 2 of getting up, mention this to your doctor. It's worth investigating. Warning, sign number 2, shortness of breath during normal activity. Feeling out of breath going up a flight of stairs, walking briskly to the car, or carrying groceries is not just getting older. It can be a signal that your heart is working harder than it should, which may be a consequence of sustained high blood pressure weakening the heart muscle over time. Warning, sign number 3, nosebleeds. While nosebleeds have many causes, frequent nosebleeds, especially unprovoked ones that are difficult to stop, can be associated with very high blood pressure. A single occasional nosebleed is usually not a concern, but if you're having them regularly, blood pressure should be ruled out. Warning, sign number 4, vision changes. This is the one most people miss. And this is why I said not to ignore number 4. High blood pressure damages the small, delicate blood vessels in your eyes, a condition called hypertensive retinopathy. This can cause blurred vision, spots or floaters, or a sensation of visual disturbances, particularly after exertion or stress. Many people attribute these vision changes to needing new glasses or just to age. And while that's sometimes true, sudden or worsening vision changes, especially when combined with any other symptoms on this list, should prompt an immediate blood pressure check. Your eyes are literally a window into what high blood pressure is doing inside your blood vessels. And that is not an exaggeration. It is exactly what happens. Warning sign number 5, facial flushing. Do you notice your face turning red frequently, especially during physical activity, emotional stress, alcohol consumption, or even temperature changes? While this can have many causes, for some people, It's a direct response to blood pressure spikes. High blood pressure causes blood vessels near the skin to dilate, which creates that visible redness and warmth in the face. Warning sign number 6, irregular heartbeat or heart palpitations. A fluttering, racing, or irregular heartbeat, especially at rest, can indicate that your heart is under stress. High blood pressure makes the heart work harder, and over time, this can cause changes in heart rhythm. Atrial fibrillation, a common type of irregular heartbeat, is significantly more prevalent in people with hypertension. If you ever feel your heart beating in an unusual pattern, particularly if it lasts more than a few minutes, seek medical attention promptly. Do not wait. Warning sign number 7, blood in urine. This one should always be taken seriously. High blood pressure damages the tiny blood vessels in your kidneys. Over time, this can cause blood to appear in the urine, which is sometimes visible and sometimes only detectable through a routine urine test. Blood in the urine should always be investigated by a doctor, regardless of what's causing it. Now, 3 evidence-based lifestyle changes that lower blood pressure, and these are not opinions. These are backed by clinical trials. Change number 1, reduce sodium. The American Heart Association recommends no more than 2,300 milligrams of sodium per day for most adults, and ideally closer to 1,500 milligrams for people with hypertension. Clinical trials show that reducing sodium intake can lower systolic blood pressure by 5 to 6 points, comparable to some medications. The biggest sources of hidden sodium are not your salt shaker. They are packaged soups, deli meats, canned foods, and restaurant meals. Reading labels matters. Change number 2. The DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. It emphasizes vegetables, fruits, whole grains, low-fat dairy, and lean protein, while limiting red meat and added sugar. Studies show the DASH diet can lower systolic blood pressure by 8 to 14 points in people with hypertension. That is a significant reduction from food alone. Change number 3, 30 minutes of moderate exercise daily. Walking, swimming, cycling. Activities that raise your heart rate moderately. Research published in the Journal of the American College of Cardiology found that regular aerobic exercise reduces systolic blood pressure by an average of 5 to 8 points. For some people, this is the difference between needing medication and not. The key word is consistency, not intensity. A 30-minute walk every day is more powerful than one intense workout per week. Now let's bring this all together. If you recognized any of the 7 signs I described today, morning headaches, shortness of breath, nosebleeds, vision changes, facial flushing, irregular heartbeat, or blood in urine, please don't wait. Schedule a check with your doctor. A blood pressure monitor for home use is also one of the best investments you can make after 60. Modern digital monitors are accurate, easy to use, and can give you peace of mind or an early warning between doctor visits. If this video helped you, please subscribe to Vital After 60. We're here every week with clear, research-based information to help you live stronger, think sharper, and feel better every single day. And if you found this useful, share it with someone you care about. It might be the most important thing they watch this week. Take good care of yourself. You've earned it.